This is the one that you'll see on your blood test, everyone. It'll say Hgb A1C. So that all means hemoglobin A1C. So let's dial back for a minute. What are we talking about hemoglobin? We all kind of know from science class in school. Hemoglobin's the blood, right? A1C is the rest of that. So what that is, everyone, is a measure of the amount of sugar on the red blood cell. So the red blood cell, as you know, we have trillions and trillions of red blood cells that run around, but we are now able to measure the amount of sugar on that red blood cell. But what makes it even better is that it lets us know how your blood sugar has been running at a 3-month interval. So what does that mean? That means that when I check that, I can know kind of how you've been doing and how you've kind of been kicking it when you're not in the office with me. Oh, Dr. Redcross, I'm doing my best. I'm not eating any sugar. I'm not eating any carbs and so forth. Then I look at that A1C, and that A1C is kind of like your priest. You gotta be honest with your A1C, because it won't lie to me once I do that blood test, right? And so the A1C is a beautiful metric. And as you will hear more as we talk today, you'll see why I am bringing that into our kind of bonding with our blood work series. So the A1C is important. Like I said, it lets us know how much sugar is on the red blood cell in a 3-month interval, which really gives us a snapshot, a sneak peek into how things are going, not just catching you in the act like that other example I gave you, but also seeing how we're doing with your medications. The medications you're on, are we doing a good job with your diabetes management or what have you, right? So one of the things that's really important for you to know, how many diabetics are there in this world? I will give you one guess, just one. I'll pause for a second. All right, got to go. You know, YouTube is fast. So the point is about like 1.2, 1.3 billion. The numbers are always changing, but think about at least 1 billion people in this world actually have diabetes. So think about that. That lets you know kind of where we are as a people, and how important this is, and why I brought it in to this lab test, this bonding with our blood work discussion that we're having there. So as we talk about diabetics, and I'll dive into just a smidgen. The other point I want to dive into is that there's also a group of people who are pre-diabetic. And so what is diabetes with that particular hemoglobin A1C that we're learning today? Well, diabetes is when that number is over 6.5. So when that number is over 6.5 under normal metrics, you can look at different lab tests, but for the most part it's 6.5 for this particular lab test, and there's a diagnosis of diabetes. The thing I want everyone out there to really perk up and write this down, if it's between 5.7 and 6.4, you are pre-diabetic. Now, why am I bringing that up? Well, because here in the United States, there's almost 103 million, last count of 103 million people are pre-diabetic. So what does that make me feel as a physician? Well, even my folks who do have diabetes, I still feel wonderful, because I know there's some wonderful things that we're going to do to make your life better and to be able to keep down complications and that sort of thing. That's the important thing. But when I hear that over 100 million people in the United States are pre-diabetic, that also means for me that there's opportunity. There's opportunity to really educate people. There's opportunity to keep those folks from going into the diabetic category, which is not necessarily the bad category. So I'm not trying to paint it that way, because there are things that we can do to make sure that complications are reduced. But what I mean is, it's just another opportunity to make a difference in a lot of people, is what I mean by this. And that's why it's so important to kind of understand the numbers. Those people who are in the pre-diabetic category can have glucose intolerance, meaning they have glucose, but their bodies aren't necessarily recognizing that insulin is there to help drive the sugar into the cell. It's important when you get this particular blood test to take a look, because lots of times when your blood sugar is out of whack, some other things are out of whack. Your blood pressure, your cholesterol. You'll hear these things when you hear about the metabolic syndrome, everyone, which is a syndrome of all these things, with sugar being off, blood pressure being elevated, cholesterol being off. These are things that we're trying to prevent because we know that that causes more challenges and more dis-ease, which we do not want. So that's why today, understanding what your hemoglobin A1C says number-wise is important, that when you get this, you also follow this, write it down, and you kind of follow a trend as to when your doctor is actually monitoring and looking at your hemoglobin A1C. Now, as we talk about diabetes, look, we have so many wonderful medications on the Western side, especially, that can make a big difference in your blood sugar. The good thing is, even in those who are not necessarily more Western medicine inclined and they want to go a different direction, especially for those in that pre-diabetic, sometimes some physicians around the nation kind of start something when they're pre-diabetic. Once again, coming from the holistic side of healing as well, I know that there is a great botanical called berberine, which has shown wonderful studies as well, especially in that pre-diabetic realm, to kind of help to support blood sugar as well. So the one thing I want you to look at or understand is, when you look at this, and if you see your hemoglobin A1C, I'm sharing all of this because I don't want you to worry. You don't have to worry, because there's something that we're going to be able to do to prevent the complications. But we can't do it if we don't know that you have a blood sugar issue. So that's the reason why I said I want to make sure that all of you out there are asking to make sure your doctor does do a hemoglobin A1C at some point and figure out what's the best value for you. But until you understand what it is and the reason for getting it, you won't know how important it is. And I want you to literally jump up and down and say, look, Dr. Redcross told me I need to understand what this is. I need to know what mine is. Now, when you deal with diabetes, and also becoming in that pre-diabetic category, there are certain things we want to really be careful of. We want to be careful of our eye health. Eye health is very important. Now, diabetes affects different blood vessels. Big ones, meaning the ones that go to our heart, the ones that go up to our brain, some big vessels. But the eye health is an example of how diabetes and the sugar itself can affect small blood vessels behind the eye. Those sort of things are what we want to make sure that when we're looking at this A1C, hey doc, do I need to be treated? Hey doc, am I in the pre-diabetic, and start doing some lifestyle changes and intervention? All of these are the perfect place for making sure you're watching what you're eating and you're exercising. Helps for both diabetic or pre-diabetic. So it is all encompassing that we're doing that. Not only am I concerned about getting these numbers about the big blood vessels to the heart, or big blood vessels to the brain, or the small blood vessels to the eye, I'm also concerned about the small blood vessels to the kidneys, which are located back here, everyone. And so there's small blood vessels that go there to little units that we call nephrons. And the nephrons are these little units that are in our kidneys and allow them to churn and work all day. Work beautifully. The body is amazing, isn't it? So freaking amazing. And I love that I want you to be right on that level with me and get what I'm talking about when I say a nephron. And now you'll know also why it's pretty cool that kidney doctors are called nephrologists. Now you get the relationship between the two. The point is, when we're seeing that A1C, look, we've been able to talk so much about just that one test now without even getting even deeper into the challenges or things that we should address. That's how important it is. And so this is important because this is a test that's not always on there on your blood test when you have to go to the ER. And to be quite honest with you, you don't necessarily need it on the test when you go to the ER, when you go there because you injured your elbow, because you hurt your knee, or because you're not feeling well, you're under the weather. So it's not a test that is the routine thing. I just need you to know what it is, and I need you to ask for it to make sure you get it at some point, to make sure, okay? The other thing I want you to recognize is a diagnosis of diabetes or prediabetes, I don't want it to be taken with so much doom and gloom. It's something that we're able to not only treat and manage well, but it's also something that we're learning more and more about and getting other medications that are fabulous. I know you guys have heard of Ozempic. If you live on this earth in this solar system, you have heard of Ozempic. Ozempic is a GLP-1 and blah, blah, blah. So it's something that helps differently than even when I was in training. So in other words, there is so much hope. So this is not doom and gloom. This is about how are we going to navigate our situation? How are we going to make sure that we're getting that spiritual wealth that Dr. Redcross talks about? Well, we do that with education. And the whole point of this series, the whole point to talk about these things is to make sure that you also feel empowered. It's the empowerment I want you to have now. When you look at these lab tests that we talk about and you say, I got this. I got this. And when you get that feeling, I guarantee you're going to walk out with your head up, your chest out, your arms back and say, I'm doing this thing called life pretty darn well. And I want all of you to feel that way. So, once again, if you found this valuable, if you found this helpful, please like, subscribe, share, and above all, feel free to ask questions because any way I can help you, I'd be more than happy to be a part. Take care and talk soon. Hey everybody, Dr. Ken Redcross here. If you don't know, I love the patient-doctor relationship. It is so important. So my question for you is, who wants to live longer? We all do, right? So therefore I've written 2 books. This first book is called Bond. It's the importance of trust, respect, empathy, and communication with your doctor, because I believe if the relationship is perfect, then it will help you live longer. But how can I really make sure you live longer? Well, I decided to write a second book. This is the 15-minute Bond Blueprint. This particular book helps you go minute by minute of your 15-minute visit to make sure you get the perfect doctor relationship and visit that you all deserve to make sure we extend our healthcare journey.